Good morning and welcome. Welcome to our episode 2 of our heart failure awareness series. And today we learn what causes heart failure, from hypertension to broken heart syndrome. In our part 1, we learned what heart failure is. It is when the heart becomes weak. The cardiac output, the amount of blood pumped out of the heart, is not enough to meet your metabolic requirements. So what causes heart failure? Heart failure does not just happen. It occurs gradually, years and years of neglect, stress, damage, or disease that gradually weakens the heart or stiffens the heart. And what are some of the most common causes? The number one cause of heart failure is hypertension or high blood pressure. This is number one cause worldwide. The heart pumps against high pressure for years. This makes the heart muscle to stiffen, to get weak, and eventually weaken, and the heart gets weak. The number two cause is diabetes. If you have had high blood sugar for long, which is not well controlled, this destroys both the heart muscle or the blood vessels in the heart, leading to the heart being less efficient. Heart attack, people who have had problems with the arteries in the heart, blockage, this makes part of the heart muscle to die, and the heart cannot pump anymore, or the pumping is not efficient. We have people with problems with valve disease in our setup, things like rheumatic heart disease. You have problems of the heart valve, where the valves can be leaking or the valves are too tight, and this makes the heart have a lot of work to do and can lead to heart failure. Severe infections, viral infections, can lead to what we call myocarditis. They can affect the heart muscle, and this can lead to heart failure. Pregnancy is also another very important cause of heart failure, what we call peripartum cardiomyopathy, where the heart fails before delivery, and we'll discuss this in later sessions. There are other causes that are commonly overlooked, things like alcohol. Alcohol is also a common cause in our setup, where we see patients coming with alcoholic cardiomyopathy. The alcohol drinking over the years makes the heart muscle weak, the heart enlarges, and you present with heart failure. And the good thing is some of these are reversible causes of heart failure. Certain medications and chemotherapy, if you are on cancer treatment, the cancer medications can also cause heart failure. And before you start on chemotherapy, you are meant to have an evaluation, and your doctor should alert you if the drugs you are using can affect the heart, so that you have evaluation before you start your chemotherapy and even after you complete treatment. Problems of heart rhythm, what we call arrhythmias. For people with palpitations, you need to be assessed, because long-standing arrhythmias can also lead to heart failure. The heart is not working efficiently. Chronic lung diseases, people with COPD, can strain the right side of the heart, causing what we call cor pulmonale. Other conditions are like thyroid disorders that can also stress the heart. And finally, broken heart syndrome, what we call Takotsubo cardiomyopathy. This is triggered by extreme emotional or physical stress, and this mimics a heart attack and suddenly weakens the heart. The bottom line is that most of these causes are there, and they slowly weaken the heart until you end with the heart failure. It is important for us to know those are the causes, so that with regular checkups they are treated. If you have hypertension, if you have diabetes, you need to have those treated well, so that you do not lead to heart failure. We need regular checkups. We need to be aware, because they should be treated and controlled before heart failure develops. So tag a friend who has hypertension, who has diabetes, so that they can hear this. So stay tuned for our episode 3, where we will discuss, are you at risk of heart failure? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.